Welcome to This Explainer. Today we're diving into a total paradigm shift when it comes to senior safety. If you or a loved one are navigating the aging process, you probably know the basics, but we're about to uncover a hidden risk that the medical and caregiving communities honestly overlook way too often. We're keeping our focus grounded and entirely resident first today. Let's get right into it.
Picture this. It's 2 a.m. The house is completely dark, completely quiet. Now, most of us just assume falls happen during the day, right? We picture someone feeling weak or frail, maybe losing their balance in the middle of the living room. But that assumption completely misses the mark for a lot of folks. The real danger? It actually begins in the pitch black of night, long before that morning alarm ever goes off. Just think about the contrast between the absolute safety of a warm bed and those hidden, shadowy hazards lurking in a dark bedroom or hallway.
So here's a question that might totally change how you look at aging. When does a fall actually begin? We usually think of it as a single split-second event, a quick trip over a rug, a slip on a wet floor. But if we kind of rewind and rethink the timeline of physical instability, it's wild. The risk often starts hours before the sun even comes up. It starts right in the middle of the night, rooted in disruptions that completely alter a person's physical state.
Section 1. The hidden fall risk. And that hidden domino? It's nocturia. Simply put, that's the need to wake up repeatedly during the night to use the bathroom. Honestly, it's incredibly easy to dismiss this as just a normal, maybe kind of frustrating part of getting older. A lot of people just shrug it off as a harmless bladder annoyance. But here's the thing. Treating it as just a minor inconvenience misses a massive piece of the safety puzzle. Waking up 2, 3, 4 times a night fundamentally compromises a person's well-being. It literally sets the stage for severe accidents.
In fact, research points to a pretty staggering metric. We're talking about a 2 times increase in fall risk. Studies strongly link repeated nighttime bathroom trips to falls and fractures in older adults, nearly doubling the danger. And it compounds, too. The more often someone wakes at night, the higher that risk spikes. It's a mathematical escalation of danger happening exactly when the body is least prepared to navigate the physical world.
Just think about the physical toll here. You're suddenly yanked out of a deep sleep by a biological urge. That fragmented rest directly leads to slowed reaction times and, you guessed it, sudden confusion. You're trying to orient yourself in the dark while your brain is basically still half asleep. Add in a highly affected sense of balance, and suddenly walking down a dark hallway isn't just annoying, it's practically a high-wire act. For a lot of older adults, the bladder isn't the main problem. The real issue is the compromised, groggy physical state they are forced to navigate in. Section 2. The Mobility Cascade. You see, the consequences of those 2 a.m. trips don't magically vanish when the sun comes up. It usually starts with just one nighttime stumble. It might not even be a full fall, maybe just a close call catching a door frame. But that single stumble breeds a really deep-seated fear of falling, and with that fear comes a devastating loss of confidence, which leads straight into reduced activity and less walking during the day. Over time, that lack of movement brings on growing physical frailty. It's a tragic cycle. Losing confidence at night literally shrinks a person's daily independence.
And we absolutely cannot forget that this cascade doesn't just happen to the individual. Imagine being a caregiver, lying awake, listening for the creak of floorboards 3 times a night, every single night. The whole ecosystem of care takes a massive hit. The burden of constant 2 a.m. wake-ups causes profound caregiver exhaustion. Families end up living in this state of chronic, hyper-vigilant worry, just dreading a terrible phone call. The stress ripples outwards, impacting the physical and mental health of literally everyone involved. Section 3. Reframing nighttime stability. For years, the old view treated nocturia merely as an isolated urinary symptom, something you just manage solely with a urologist. But the new view? It recognizes the condition for what it truly is, a broader marker of physical instability and functional decline. The goal for medical professionals and caregivers isn't just treating a bladder anymore. The holistic goal is achieving safer nights and better daily function. Because honestly, what happens at night completely dictates the energy, safety, and success of the very next day.
Section 4. A gentle external approach.
Now, before we look at how this new practical support works, let's talk about what the Kidney Vitality Herbal Pouch from 5 Essences actively avoids. There are no pills, no injections, and absolutely no complicated setups. Think about an older adult who is already juggling multiple medications and dealing with the fatigue of endless doctor visits. Avoiding yet another oral medication or invasive procedure, that's a huge comfort. It really emphasizes dignity, simplicity, and a resident-first approach to wellness.
So what is it? It's a 100% external herbal pouch, worn comfortably right over the navel area using a soft support belt. That's the whole shebang.
It is a completely physical, external product designed to offer a really gentle wellness routine. The aim is to support nighttime stability completely from the outside, keeping things as comfortable and straightforward as possible for the user while they sleep.
Section 5. Observational evidence and caveats.
When we look at documented observational case series involving patients with nocturia, a pretty fascinating dual benefit emerges. On the patient side, using this external pouch resulted in reports of fewer nighttime trips, which of course naturally leads to significantly better sleep, clearer thinking, improved daytime energy, and better mobility. But just as importantly, caregivers reported calmer nighttime routines, way fewer disruptions, and a massive reduction in their own anxiety. It is incredibly clear how addressing the night really helps heal the entire caregiving ecosystem.
Now let's pause for a second because we have to keep an objective and rigorous lens here. As this notes, these findings are observational and do not establish causation. While these documented cases are definitely promising and offer an exciting look at non-invasive support, we have to stay practical. Causation hasn't been definitively proven, and rigorous, controlled research is still entirely necessary to fully understand the clinical impact.
Section 6. Calmer nights, better days.
We so often think of fall prevention purely in terms of physical tools, right? Adding more walkers to the hallway, installing grab bars in the bathroom, or setting up complex bed alarms. But true prevention goes way beyond those reactive measures. It begins fundamentally with quieter nights. Because a quieter night leads to better sleep. Better sleep creates safer, way more confident movement during the day. And all of this results in calmer, healthier caregiving. Addressing nighttime stability really is the true foundation of preventing falls.
Which leaves us with an incredibly powerful reframing of senior care. Sometimes the hidden domino behind better aging is exactly what happens at 2 a.m. It shifts our entire focus right to those quiet, dark hours that hold so much unseen influence over our health, our mobility, and our long-term independence.
If you want to dive deeper into the source material and explore this supportive wellness routine for yourself or a loved one, you can learn more about Kidney Vitality External Herbal Pouch Therapy at 5essences.store. As their philosophy states, use outside, support inside. Thank you so much for joining me for this explainer. As you look around your own home or think of an aging loved one, I want to leave you with this. Are you only preparing for the hazards of the day? Are you finally ready to secure the night?